support. I recently, on the back of the federal election campaign, ran my own series of health inquiries and Medicare forums in my electorate to ask people directly what were their concerns, what was their experiences of healthcare, primary healthcare across the Bendigo electorate. We held several forums, Woodend, Kyneton, Castlemaine, in Maldon, in Heathcote, in Elmore, and across the Bendigo, Greater Bendigo region. So we didn't just stick to Bendigo, as in the CBD. We got out and asked people. We heard from health professionals, from pensioners, from families, from patients, from people working in the sector, and asked them what was their experience of healthcare, what was their experience of primary health care, and what were their recommendations. And the findings of our inquiry are quite alarming and back up a lot of the evidence that we have heard about regional people accessing healthcare. What we found was that in our survey that 87% of people believe that the cost of healthcare has gone up in the last 12 months, including the cost of prescriptions. Maybe it's not just the prescription that they get on PBS, but the extras that they also have to pay for to go with that prescription. 40% of the people who attended and participated in the Bendigo electorate said that they had delayed seeing the doctor because of price. 40% of people in the Bendigo electorate. 100% said that they believe that the government should protect Australia's universal healthcare system and invest more. This is the most alarming statistic that we found, that on average, the out-of-pocket patient expenses for going to the GP was $21. This is the gap fee. Out of a sample of 23 clinics in the Bendigo region, only 4 now bulk bill non-concession card patients and only 11 bulk bill concession card holders. 4 across Greater Bendigo bulk bill, 100% bulk bill. Only 1 in the postcode 3550. This has happened just recently. Under this government, we've seen a collapse in bulk billing rates in my own electorate of Bendigo. It was actually quite shocking to not only listen to people about 40% delaying seeing a doctor, but then to learn why, that it's only our community health service that bulk bills now in the postcode 3550. And across Greater Bendigo, if you don't go to a Bendigo Community Health Facility, it's a TriStar where it's a 6-minute consultation. That's the only way you can see a bulk billing doctor in the Bendigo electorate. Some of the fees charged by doctors, even for concession card holders, was as high as $31 out of pocket. We had someone attend the Heathcote hearing who travelled down from Rochester to say that in their town it's $50 out of pocket to see a GP. $50. Now, this isn't the inner city of Melbourne where incomes are high. This is regional Australia, regional Victoria, where about 30% of households in my electorate are trying to survive on $600 a week. These are households, tens of thousands of people who are living on fixed incomes, whether they be pensions, disability pensions, age pensions, whether they be unemployment benefits or a group of growing underemployed people. These are people who are struggling to cover the cost of the basics and are now paying more than ever to see the GP. And if this government gets this way, even more for pharmaceutical benefits. This is a government that has lost touch with people on the ground when it comes to the cost of healthcare. I'll state the statistic again. 40% of people that we surveyed in the Bendigo electorate, a regional town and a regional electorate, said that they delay going to the doctor because of price.